It's another Wednesday morning in the ancient city of Ibadan, and I welcome you to your favorite health program, Your Health, on Ray Power 95.1 FM Ibadan. I remain your humble host, Nedu Okorie. You can simply call me Nedu. Some of my friends refer to me as the radio doctor. Since you are my friend, you can also call me the radio doctor. Special thanks to the producer of the program, who is also the head of station of Ray Power 95.1 FM, Madam Folakemi Awoshen Agbakoba. I also appreciate those who have been contributing to the program via my social media handles. I really appreciate your contributions. And last week I asked some questions, and a lot of people didn't get to listen to the question correctly. Maybe some other time we might put out some questions for you to answer to win some prizes. Alright, for those of you that don't know my social media handle, on Instagram I am at Nedu_Okorie. At Nedu_Okorie. On Twitter I am at Nedu Okorie. While on Facebook you can just search Nedu Okorie. Alright, to our Muslim brothers and sisters, we say Ramadan Kareem to those that celebrated the festive period, and we are still expecting some of the goodies from our Muslim brethren, especially from Uthman and Co. The 1st of May 2022 was National Workers' Day, a day set aside to celebrate and honor the hard work and labor of the working class in our country. It is also a day when the workforce make their opinions and views known to the government based on the quality of welfare as well as the infrastructure in the civil service. As part of the Workers' Day celebration, we'll be airing some opinions and some views concerning the state of health, not just the state of health, the state of health practitioners and the health sector in general. Few health workers will be airing their views on the state of the health practitioner and the health sector in the country. And remember, their opinion are their opinion. Every opinion that is going to be aired is the opinion of those individuals. They are not the opinions of Ray Power 95.1 FM Ibadan. And so far we've seen a lot of news that came up during the commemoration of the Workers' Day in Edo State. The Edo State governor increased the minimum wage, I think from 30,000 naira, increased it to 40,000 naira. That's a good plus, and I think other governors can also emulate from this gesture. The next audio tape you're going to be listening to are the voices of the health practitioners. We have Dr. John Ugwe, we have Dr. Pelumi Olani, as well as a nurse, Miss Femiola Grace. Yes. So keep it locked on to Ray Power 95.1 FM Ibadan. I'll be back shortly.
Good day, everyone. My name is Dr. John Ugwehi. I am a medical officer currently working in the city of Ibadan. I have been a health practitioner for 3 years now.
Good day, listeners at home. My name is Dr. Mrs. Olani. I'm a medical doctor and I'm a medical officer precisely. I've been practicing medicine for about 3 years now.
My name's Miss Femiola Grace Polanli. I've been in the profession for about 3 to 4 years now. The profession, to me, it's a passion.
The passion, the purpose it brings, the power that you have to actually be able to know what to do in order to save lives. Lastly, I would say the prestige.
When I think about the things that propelled me into being a medical doctor, I think it's the fact that I wanted to save lives.
If it's not nursing, there is nothing for me. It has always been nursing all the way. It is a calling for me.
I wanted to be able to, contribute to my society in a positive way.
Uh, Way back in the 1970s, 1980s, medicine was that promising future, and most parents tilted more towards their kids being medical doctors. Currently, the paradigm may have been shifting.
I am of the opinion that any field or any profession we find ourselves, whatever we find ourselves doing, I think striving to be the best at such should be the priority. I would not want to regard any profession as the best.
On this line, I would advise parents to actually look into the children God gave to them so that they will see if those profession they want to enforce them or they want to enforce on them, they will actually thrive better.
My experience in the industry really is not what I dreamt of, to be sincere. We as medical students, we always watched Hollywood movies. We saw how things played out over there, and coming into the real world in the Nigerian setting is really not what I imagined.
When you are into health profession, be it nursing, be it a doctor, a scientist, it takes a lot of your time. A lot of your time. If you don't know how to juggle between your profession and the social world, I think it will just be as if you are so hard from others. Yes, it takes a lot of time.
So far for me, well, if medicine was all it was I did, it would probably not be the dream I wanted or the dream I had or things I imagined. No, but things are getting better, and we are hopeful that the industry will blossom.
Some of the perks of the medical profession, well, the fact that a lot of people respect this profession actually is something that makes me happy. So many people tell us things that they've not even told their partners, and we're expected to be able to manage such information correctly. So I think that is one of the perks of the profession, and the fact that I would not say we are financially stable as many of my colleagues would agree with me, because it's not like we make ₦1,000,000 per month or something, but a medical doctor should on the average be comfortable. So I think the security that comes with the profession, the job security that comes with the profession, is something that I'm happy about. Also, the fact that a lot of times or sometimes we see the results of the efforts we put in. For instance, we have a child that is about to die, and you do your best, and you see the child come out of very severe diseases, and you are very happy that the child was able to make it. So I think that is one of the good things about practicing medicine.
The most important aspect of the medical profession that I love is the joy basically that you give the patients when they're healthy. When a sick baby becomes strong again and feeling well and fit enough to go home, that joy is palpable for me, and it's very, very important for me. I don't trade it for other considerable perks like the financial aspect or the social prestige. The most important thing is that you are doing your best in order to put smile on people's faces.
Of course, there are general challenges with being a medical doctor. The fact that the government is doing little to nothing to make um, equipments available, and the fact that a lot of people are not under the health insurance scheme and they have to pay out of their pockets. So most of the time we deal with, poor patients that really don't have the finances to take care of their health. So I think that is one of the major challenges that I've dealt with in the health sector. So the fact that a lot of politicians, they say all sorts when they want to get into the office, and then when they get to the positions, they practically don't remember. I think it's because most of them don't even regard the Nigerian health sector as functional. They think about the fact that okay, they can get whatever healthcare they need outside the country at at the tip of their fingers. So I think that is one of the major reasons why they feel like okay, there's really no need to invest in the health sector of the country.
Well, I would say we need more innovations. There are great improvements to the practice of medicine in more developed countries, and this has been known to improve the outcome of care. And most of these things still happen to be um, trapped or held back from us. And this is one of the reasons why a lot of doctors want to go out there to improve their skills and hopefully return home. So if we can bring those things here and apply them here, will probably make home a better place as well. Also, the education, the medical education, needs to be improved because it appears that we have been trained with old curriculum, and there needs to be an introduction of something new, things that are novel and can make the doctors of tomorrow much better.
Health sector, especially in Nigeria, needs reformation. We need a good reformation, and reformation only starts from individual. Let me use that word. It starts from individual. Before you can reform a nation or a state, your home and your life must have been well reformed and organized. Health sector is supposed to be highly esteemed. They're supposed to be highly cared for. I see that most people that even suffered in health sector are nurses. Yeah, doctors still benefits a lot sometimes, but nurses, the way they look at them as trash, and they are the major heartbeat of the medical team. The major, they are the ones stays with the patient. They knows the feelings of the patient. They know the groaning. They know how the patient is feeling. They observe everything in detail.
Well, to be factual, the major way the government of Nigeria has contributed to the growth of the health system is the fact that there's now more awareness of national health insurance schemes, and a lot of people are now aware that they don't have to pay out of their pockets to get the common medications that are available, and the fact that there's a lot of awareness on vaccinations and immunizations. So I think that is one of the major areas that the government of the day has invested into the health of the general populace, because if we look at other things majorly providing facilities like let's talk about CT scans and the rest. This is nothing to write home about. So, but when we look at what they've done to eradicate the common diseases, common childhood illnesses like malaria, we have many free anti-malaria drugs. They are doing their best when it comes to provision of mosquito nets and subsidizing the prices of insecticides, I think. So that has gone a long way, and we've been able to successfully eradicate polio, I think. So I believe the government is trying their best, but the most important areas where they need to focus on majorly is areas like malignancies, talking about provision of chemotherapy machines, providing common investigative machines like CT scans, MRIs. Those are not readily available, and when a patient really needs such, they have to pay huge amounts of money to get the investigations done. So well, I would agree with the opinion that the health system of Nigeria is nothing to write home about when you compare it with international standards. I mean, most surgeries now are being done robotically. A lot of people don't, a lot of countries don't even do open surgeries anymore. There's provision of many minimally invasive surgeries that ensure that most patients get better faster, and then they don't really go through so much pain while being operated upon. So well, I think the government should address critically the amount of revenue that is even being pumped into the healthcare system. I believe that if there's a policy that most stakeholders cannot get healthcare outside of the country, I think it would enable them to focus on the healthcare system of Nigeria. So if the government is ready to look into how the general populace is going to get the best healthcare, I think we need to look at family planning to be more available. Yes, family planning options to be more available, more readily available, and then as I said earlier, the fact that we don't really, I think in the whole country we don't have up to 10 MRI machines, so they can invest into investigative medicine and then invest into how to subsidize the common medications that are available, so that the general populace, even if you are paying out of pocket, you can get them at cheaper prices. So that is it.
The truth is that the health sector needs investment, government investment, private investment, and if the government can try to attract more of these investments, I believe there is going to be a drastic change, because there are people who are willing to serve, there are people who are willing to innovate, but then there's lack of funds. Another place that can be improved upon is making insurance, health insurance, easily reachable for majority of the populace. It's become something close to a disaster when people cannot afford their health care, despite the fact that they are workers, they're civil servants, they're citizens of the country basically.
Let individual enjoy at least some reasonable amount of medical attentions.
Health is wealth, and like you say, a lot of people actually, using your words, relegate their health to the background, and they try to do all the things, try to make money, try to run for offices, try to do all these things despite failing health. And it's something they carry to wherever office, wherever position they get to. So if you see someone relegating the health of the nation to the background, that person's health is also affected. The truth is, a healthy nation is a wealthy nation, and if we do not develop our health sector, we will keep having to travel out and get seek help from some other place because home had not been fixed when we could.
Okay, to be candid, the present economic and security situation in the country has negatively affected the populace because, aside from the fact that most Nigerians, an average Nigerian, would not want to come to the hospital. Trust me, they would rather have herbal medications or go to a traditional birth attendant. Now let's add that to the fact that they 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 cannot even afford to eat 3 times a day. They cannot afford to get balanced and nutritious meals that the body requires. So it makes it really difficult because most of them would keep postponing their appointments until they get to the terminally ill stages of whatever illness that they have, and then that makes it really difficult to help them as medical practitioners because they come when there's little or nothing that you can do to help them. So I think I agree with the fact that the economic situation has made the populace very, very negatively affected by these things, and the security situation in the country. I mean, you are not even sure what's going to happen next, and then a lot of people are struggling to make ends meet, and then maybe unfortunately the breadwinner of the family gets short or something, and then they can't come to the hospital. So that has negatively affected the masses. So if I peradventure I assume the position of the health minister of the Federal Republic of Nigeria, well, I would ensure that I enroll every child or every Nigerian into a national health insurance scheme. Now, the ones that are available currently, usually they are open to the workers, the people that might not actually need it. The people that are the grassroots that really need this health insurance scheme are not even on the scheme. So I think that is the first thing I'm going to focus on if I get to be the health minister of the country. Then there are a lot of maternal deaths, there are a lot of fetal maternal deaths, that is deaths that are occurred through child bearing. So I think I would also look at how many people, especially the grassroots now, how the women are going to be able to get the help that they need, the special care that they need to ensure that they have a smooth transition from pregnancy to the postpartum period. Do you understand? So I think those are the major things that I would really focus on, and then how we are going to eradicate totally the childhood illnesses, because malaria kills almost every 5 minutes. It kills a child in Nigeria because, of course, the children have very severe forms of malaria. So I think those are the areas that I will look into. Then I've talked about malignancies, and I'm going to think about how how they are going to get advanced treatments available, yes, readily and at cheaper prices. So I think those are the things that I'm going to focus on. Then to upcoming health practitioners, well, I would say that the country, of course, used to be better, but we can always do our best to make the country a better place. Most people want to run out of the country, looking for greener pastures and all. Well, if the aim of that is going to make you to come back to contribute your own positive change to Nigeria eventually. Of course, we can always go and come back to our country, but to those aspiring to become medical doctors, of course, please, you can do anything you put your mind to. You can always achieve anything you want to achieve, and the sky is the starting point. Actually, there's no limit. Whatever field you find yourself as a medical practitioner, I believe that you can strive to be the best at it, and God willing.
Nigeria can only get better when we make it better for ourselves. So health sector security is something I don't understand. That is why nowadays you see people going for complementary alternative services. People have now gone back to that previous hold of ways of treating themselves. They now use herbs, complementary medicine. Now that is what people do. See, they gather grasses, they know how to mix it, and those kind of things, because it is not quantified. People don't know the amount they're supposed to take in.
All right, that's much we can take on the program. You've been listening to the voices of Dr. John Ogbuehi, as well as Dr. Pelumi Olaniyi and Miss Femiola Grace. They've been talking about the state of health practitioners and the health sector in general, and I hope you got the message they were trying to pass across. According to Aristotle, when one adds pleasure in his job, perfection is evident in the work he does. Also, a man is not paid for having a head and hands. He is paid for using them. This was a statement by the 18th century American writer Albert Hubbard. On that note, I celebrate with the civil servants in Nigeria as they've celebrated the Workers' Day. That was on Sunday. I leave you with these few words. Don't take your health for granted. Your health is your wealth. Whatever you do, always get diagnosed when you start feeling anything in your body. Same time, same station, we'll continue with the program, and next week we'll be looking at a very important topic, NHIS. I remain your humble host, Nedu Okorie. Bye for now.